Today we're speaking with Howard Mann. We're going to discuss supply chain process in healthcare. So Howard, it's great to speak with you today. Can you first provide a brief background of yourself?
Certainly, Dustin. My name's Howard Mann, and I'm a Vice President of Supply Chain with a company here in the United States that works in the healthcare arena. I've worked with supply chain and information technology in healthcare for the past 35 years. I've worked in single hospitals, integrated delivery networks, which are multiple hospitals. I've worked with very small hospitals, and worked with non-acute care providers, which is something I'm doing now. So I have a fairly broad experience or past experience, and I spent 6 years working with a hospital information technology group, so that gives me a little bit stronger technology perspective with supply chain.
Thanks. My first question is, can you talk a little bit about what is supply chain process in healthcare? What's involved?
Well, healthcare in the United States is regulated by the fact that hospitals were seen as a community provider, and therefore, under our laws, they're governed by what's called safe harbors. On the supply chain side, we're not allowed to collaborate with other independent hospitals to set or fix pricing with supplies, products, services, things like that. So on the supply chain side, from a purchasing perspective, it makes contract negotiations somewhat of a challenge. So hospitals over the years were allowed under legal laws called safe harbors to work with or collaborate with an independent group purchasing organizations, of which there are between 12 and 14 in the United States. There's been consolidation across those. And those organizations can contract, and then we can participate with them and utilize their contracts. So that does put an extra layer between us and our supplier partners and our distributor partners to try to help us continue the flow of particularly products, but also equipment and services. So that along with consolidations across hospitals across the United States, with more consolidation becomes more opportunity to contract, and yet we also do not want to bypass or challenge our non-taxable status for not-for-profits or our ability to negotiate the for-profits. So there's a lot of balancing that has to be done on the supply chain side that isn't typically the same as the manufacturing or retail markets. So supply chain in the hospital side tends to focus on some fundamental things that are taken for granted on the retail or the manufacturing side. Makes it a little bit different challenge, although all of the other aspects are exactly the same as manufacturing and or retail, and we do acquisition, distribution of products, we warehouse, we have to deal with freight. We have to deal with, invoicing and billing. A lot of they're the same things, some of the same functions that retail and manufacturing. So there's commonality and there's disparity.
And can you talk about how it's done effectively?
Well, the effectiveness is the continued ability to contract nationally. And in addition, one of the things that we try to pursue in healthcare, because we're providing, basically our mission is to provide excellent healthcare to all of our patients and provide a good working place for our clinicians and physicians. So when you have an environment like that, it is a little bit different than manufacturing, where you're projecting towards a market for sales, and then you're making sure that parts and pieces are assembled in order to create a product or a service that will sell. So those are our prospective healthcare systems. They're driven by analyzing their market and managing to their stock prices if they're that kind of organization. Healthcare is providing a general, assumed level of care for their communities, and so we have to basically be prepared at all times in order to be able to provide that service. That makes ability to forecast a little more challenging within healthcare. All their continual efforts to try to accomplish that. And that makes the supply chain have to be a little more reactive as being prospective on the manufacturing and retail side. So those are challenges that we face.
And my final question is, do you have any success stories or examples you could share?
Oh, yes. I mean, there's constant improvement across healthcare supply chain. There's the fact that, initially supply chain was focused on purchasing. It was the acquisition phase of the cycle of materials that healthcare needed. And that has dramatically changed over the years, particularly through legislation, where we have things that are driving us, like safety for our patients, is now creating a federal mandate to create a unique device identifier for all the products that are used in taking care of our patients. And that's going to give us information that will help us move closer to the ability to forecast what needs to be bought. And there are tremendous efforts going on now throughout healthcare to continually move us towards a more technologically savvy supply chain. And a lot of the people that are coming into healthcare supply chain, there are a number of them that came from industry, from manufacturing, from retail, that are bringing tactics and aspects of retail and manufacturing into healthcare supply chain, where they're trying to move that forward. We're also working much more closely with our customers within our system, which not only are our patients, but are also our physicians and practitioners, in how to make quality-based decisions around the supplies, devices, equipment, and services that are purchased or acquired, which helps us negotiate more effectively. So there are many, many exciting things going on in the healthcare arena today that is going to move us to where we need to be in the supply chain part.
And thanks, Howard, for sharing today on this topic of supply chain process in healthcare.